Warning, this video contains images of medical procedures. Throughout history, there have been medical procedures that range from strange to horrifying. This list is a selection of procedures that are in practice today. Some are normal and some are quite odd. Cryogenic chamber therapy. The least disturbing of all the treatments on this list. Cryogenic chamber therapy is used for the treatment of sore muscles, joint pain, anxiety, depression, multiple sclerosis, and rheumatoid arthritis. Liquid nitrogen, negative 321 degrees Fahrenheit or negative 196 degrees Celsius. So cold it will freeze a rose hard enough that it will break like glass. Before entering the chamber, you must wear gloves, socks, underwear, bra for women, sometimes ear and mouth covers. Vaporized liquid nitrogen is blasted into the chamber, lowering the skin's temperature 30 to 50 degrees Fahrenheit in about 2 to 3 minutes. Exposure to the extreme temperature triggers the release of anti-inflammatory chemicals and endorphins throughout the body. In October of 2015, an employee at a cryotherapy center in Nevada entered a chamber alone at the end of her shift. She wasn't found until the next morning. The woman died within minutes of entering the chamber. Leeches. Leeches have been used in medicine for over 2,500 years. However, the use of leeches in medicine wasn't officially approved until 2004. Leeches are commonly used to treat abscess, boils, painful joints, glaucoma, skin grafts, and limb reattachment. As it feeds, the leech releases a blood thinner that inhibits blood coagulation, improving circulation in the surrounding tissue. During a medical procedure, the leeches are placed on the specific area the doctor needs it to be. They are replaced as they fall off. Typically, each leech eats its fill in about 20 minutes. This process can go on for 2 days or longer if needed. Fecal transplant. Just as it sounds, taking feces from one person and putting them into another's intestines. But why? Clostridium difficile. Clostridium difficile is a serious infection that is highly contagious. It spreads from person-to-person contact and by spores that are ingested. It usually infects someone after the good bacteria in the digestive tract has been damaged by antibiotics. It can cause severe damage to the colon and even be fatal, with an estimated 15 to 30,000 deaths a year in the US alone. A fecal transplant gives you an overload of healthy bacteria to help you overcome the infection. The success rate is much higher than treatment with antibiotics. The transplant can be given by enema, down your nose with a tube into the intestines, with a colonoscope, or by a frozen poop pill for the bravest patients. Hemispherectomy, aka removing half of your brain. This surgery is for the treatment of people with extreme epilepsy. For those who have more than 12 seizures a day and the medicine does not help. A seizure is an electrical surge that starts at one spot in the brain and radiates across the rest rapidly, causing loss of consciousness and bodily control. Approximately 75% of patients are nearly completely seizure-free after the side of the brain that initiates the seizures is removed. After a hemispherectomy, you lose the use of the hand opposite of the hemisphere that was removed, and vision on the side that was removed is lost. The less severe option is to just have the bridge in the brain, the corpus callosum, cut. This prevents seizures from spreading across the entire brain. If a corpus callosomy is performed, it prevents seizures from affecting the whole brain and preserves the use of both hands and eyes. Now for quite possibly the most disturbing but innovative procedure you've never heard of. OsteoDanto keratoprosthesis, tooth and eye surgery. A procedure for patients with damaged outer eye tissue that makes them blind. It involves pulling one of your teeth, shaping it to be flat, inserting an optical cylinder in the tooth, then implanting it in your cheek for a few months to grow tissue around it. At the same time, a piece of mucosal lining from the cheek is transplanted onto the surface of the eye. Once the tissue has grown around the tooth and cylinder, it is time to move it from the cheek and implant it into your damaged eye. The transplant is based on the idea that once the body senses a tooth instead of a mechanical implant, the body won't reject it. After the eye and implant heal together, the patient regains a very good level of vision. Thank you for watching. Please subscribe for more videos like this. Please also give it a thumbs up if you liked it, and if you didn't, give it a thumbs down. If you have suggestions for videos you'd like to see, please leave them in the comments below.